हमारे दिनचर्या में और संस्कृत पे ले गई, जहाँ पर कि एक ही श्लोक बताता है, यथा ही कनकादि नाम से लेके नवसी इंदुवत। तो वहां पर तो अंजन के प्रयोग के लाभ बताए गए हैं, लेकिन मॉडर्न मेडिसिन वाले तो किसी प्रकार का अंजन नहीं, कोई स्लैब्स नहीं, कोई भी कॉलिंग नहीं, कोई ऐसा बताते रखते हैं। लेकिन आपने ये बताया कि इधर हम आपको
चेंज हो गई है सर।
जी सर, और भगवान की तरफ से हमें जो पलक दिए गए हैं वो सबसे बड़े सनग्लासेस हैं, और उनके अंदर का एक्लिमेशन जो रिंसिंग करता रहता है। थैंक यू सो मच। आगे कभी अच्छी चर्चा करेंगे। हमारे आज तीसरी वेबिनार के टॉपिक का लिंक तैयार हो गई है। ओवर टू प्रोफेसर पवन शर्मा। नमस्कार।
बहुत बहुत आभार आप सबका पुनः जोड़ने के लिए। आज PTSD डे है, पोस्ट ट्रॉमेटिक स्ट्रेस डिसऑर्डर डे। अवेयरनेस के बारे में मैं क्या कहूं, अब तो ये गिनती में आ गया है कि इतने लोगों में इतने में होता है, माने प्रिविलेंस इतनी ज्यादा है कि आज पोस्ट ट्रॉमेटिक स्ट्रेस डिसऑर्डर, अब ट्रॉमा तो आजकल आदमी कहीं ना कहीं किसी न किसी रूप में रोज फील करता है, लेकिन उससे स्ट्रेस हो और जिंदगी बिगड़े ऐसा उचित नहीं है। तो आज इस पोस्ट ट्रॉमेटिक स्ट्रेस डिसऑर्डर के लिए हम 811 पायदान पर आप सबके सामने उपस्थित हैं। आप सबका हार्दिक स्वागत करते हैं। बहुत बहुत आभार जुड़ने के लिए, आदरणीय अग्निहोत्री सर।
Thank you, Professor Pawan Sharma ji. It's our great pleasure that today again we are going to have 3 consecutive webinars in the series, and the third one is post-trauma stress disorder. First of all, I would like to welcome both the distinguished guest speakers, Dr. Hema Malini, now from Chennai, but now from Germany. And the fact is that she is coming today for a very, very big gap of so many months. And Dr. Our Ashish Fatke Sahab, he is always with us. So both the distinguished guest speakers are welcomed here. When we talk about the subject itself, though the time is very getting late, 3 words itself are full-fledged words disturbing us. The one is trauma. Trauma itself directly involves the physical health as well as the mental trauma, psychological trauma, physical trauma, and all. So goes the case with the stress, having a varied etiologies, and again the disorder. These all 3 words, if taken as separately, they carry a lot of meaningfulness and of every human being. So our distinguished guest, and for that continuation, I hand over the mic to Professor Pawan Sharma. Thank you, sir. Namaskar.
Thank you, sir. Thank you, अग्निहोत्री सर। मैं अब डॉक्टर हेमा मालिनी जी को सादर आमंत्रित करता हूं। आजकल वो जर्मनी में है, मैं उनको बधाई देता हूं जर्मनी में जाने के लिए, और 1.5 साल जर्मनी में कम से कम रहेंगी वो, तो मैं उनको बहुत बहुत हार्दिक बधाई देता हूं कि उन्होंने वहां से भी आयुर्वेद का झंडा फहराया है। मेरी छोटी बहन डॉक्टर हेमा मालिनी, वेलकम है।
So before that, yeah, global namaste to all. So before that, may I ask how many minutes do we have to go
15,
ahead?
20 minutes.
20 minutes.
15 to 20 minutes.
Yeah, thank you. Thank you, sir. So global namaste to all. I am here after a very long time.
Daytime in your country, doctor? There is daytime in your country?
No, sir. It is actually now. It is actually 7:30, but it seems to be like that because it is summer time here.
Okay,
so it seems to be like 4:30 or 5:30.
Okay.
So it's a very long. It is very. You're in the midnight actually, so I don't want to waste much of your time. So I'll start with this. So PTSD is nothing but post-traumatic stress disorder. So this actually this develops only with certain individuals. It doesn't happen with all the individuals who undergo stress. Those who have the avara sattva, is actually prone to have the post-traumatic stress disorder. And actually, it is experienced after some undergoing some traumatic or any undesirable events, any shocking or any scary events. So this comes actually under the classification of DSM-4. DSM is nothing but Diagnostic and Statistical Manual of the Mental Disorders. So previously it was under the DSM Axis 4, which was having the anxiety, which was mentioned about the anxiety disorders. But now it is coming under the DSM-5 classification, DSM-5 Axis classification, where it is classified under the stress-related disorders. So previously it was having the anxiety disorder classification. Now it is coming at the stress-related disorder. So we are having the symptoms correlated to anxiety also in this. So we see the symptoms as sweating or trembling, nausea, then sleep disturbances, some nightmares, self-destructive behaviors mainly, some irritability, aggressive behavior, or we see the 4 F's here, that is fight, flight, freeze, and fawn. Fight is actually we face that situation, and flight is we run away from the situation, and freeze is without any reactions. We show no reactions, just we are static, like without any reaction, just like that. And fawning is the people-pleasing behavior, that is crying immediately, instantly after something's happened here. And mainly the sleep disturbance is seen here, followed by nightmares, vivid flashbacks also. Suddenly a flashback of the traumatic event, or panic attacks when we remind of those events. And I think so. And one more thing is hypervigilance. Vigilance to immediate trigger to being sensitive to the simple issues also. These are all the symptoms we notice with the PTSD. So the treatment for is very simple actually. So openly to say, it is very simple, but it takes a time to procure it. So it correlates with the cognitive behavioral therapy. What is cognitive behavioral therapy? It is nothing but it is a comprehensive psycho-spiritual approach that is very well correlated with our Ayurvedic science as the Sattva Vajaya Chikitsa. So here what we see is it is the interpersonal method of mitigating the sufferings, decreasing the sufferings with some using some accurate thoughts, some positive thoughts, functional behaviors, and with some structured techniques. So first what we have to do is we have to validate and acknowledge the feelings of that person with empathy. That itself makes the mountain-like thing to become like a hill-like thing. So just validation and acknowledgement of their feelings with empathy, and re-educating them to have reliable and positive, sustained positive thoughts. So again and again, we have to reinforce them with this kind of knowledge. So that makes them to come out of the stress-related disorders very easily. And we see the concept of 4 R's here. What are the 4 R's? Replacement, reinforcement, re-education, and reassurance. So first we see the replacement of the NAT with the SMART. What is NAT? NAT is nothing but negative automated thoughts. Here actually we see that certain things, when we enter into the negative energy, it again relapses again and again, it makes us to fall down. So the negative automated thoughts are to be replaced with SMART. SMART is nothing but S stands for specific, M for measurable, A for achievable, R for reliable or realistic, and T for time-related thoughts. So the NAT thoughts should be replaced with smart thoughts. This is the best way to come out of the PTSD, or not only PTSD, almost all the psychological disorders. Then we can reinforce them. Actually, it is not a one-time session or a one-time consultation we do with that particular health seeker. It is having a whole lot of sessions so that we can make them to come out of the pit step by step. It is a step-by-step process. So we have the visualizations, affirmations, relaxations, deep breathings, all these makes them to come out step by step. We see all these things in the hypnobirthing techniques in the pregnancy. So I need to explain that also later, with where I have seen, till now I've seen 3 cases, 3 health seekers who have given their, who had had their smooth deliveries, and now I'm handling one case where she is into her 7th month. So we have started the hypnobirthing techniques with her also. So this is really helping a lot. And then re-educating to have reliable and sustained positive, that is the most important. The sustainment is most important. So repeatedly having the positive thoughts, even though we see certain unwanted things happening, we have to pick out the positivity from that happening. So that is repeatedly having the positive thoughts. So re-educating, punarshikshana of that. And finally, the reassurance. We have to assure them that they will be definitely out of this, and that is going to make a whole lot of difference in their life. So these 4 R's makes the treatment part. So now coming on to the Ayurvedic part. So Nidana of every disease will be actually 3. That is Asatmendriya Artha Samyoga, Prajna Parada, and Parinama. So Asatmendriya Artha Samyoga, we are not going to deal further, and Parinama also. We are going to look into the Prajna Parada. So Prajna is the actual nature of the transcendental wisdom, and Aparada is the impairment. So impairment of this very intrinsic dimensions of the manas leads to the gaining of the improper knowledge. That is the faulty intellect. So that will be the main cause for acquiring all these psychological disorders, mainly this post-traumatic stress disorder. And here we see that the Dhi, Dhriti, and Smriti, all these are getting Vibramsha. Vibramsha is impairment. So Dhi, Dhriti, Smriti, Vibramsha, Et Kurute Ashubham, Prajna Paradam Tam Vidyat, Sarva Dosha Prakopanam. So here the Dhriti is the intellect, the judgmental power. Dhriti is the willpower, the self-control, and Smriti, as usual, the retention of power. If all these gets impaired, it definitely leads to the Prajna Aparada. So it can be, it is not only psychological, it can be Kayika, Vachika, or Manasika. And why this happens? Because the yoga is either Ati Yoga or Ayoga or Mithya Yoga of the Arthas. So all these are the Nidana for acquiring this. Now coming on to the Chikitsa, we have this Sattva Vajaya Chikitsa, that is Sattva plus Avajaya. Sattva is the actual state of manas. Avajaya is the conquest. The conquest of the mind back to the normalcy is called as the Sattva Vajaya Chikitsa. So as we previously saw, the Avara our Sattva persons are getting prone to this kind of disorders. Now our aim should be to increase the Avara to Pravara and maintaining the Raja and Tama simultaneously. So this should be our aim of this Chikitsa. So here we have Ahitebhyo Artebhyo Mano Nigrahanam Tata. So the withdrawal of the bothered mind from the unwholesome objects. So we have to withdraw our mind from the unwholesome objects. When we do that, automatically the mind gets back to its normalcy. So for that, what do we need? We need a proper intellect. The Dhriti, so uplifting the intellect, intelligence. Dhriti is boosting the confidence now and then by ourselves. So by ourselves or with any guidance or any support. So the Dhriti Smriti is the retention of memory power with the help of abhyasa, that is practice, and vairagya. Vairagya is the detachment. With these, we can increase the memory power. And then atmadi vijnanam, it's a self-realization. Samadhi, self-transcendence, that is completely concentrating on any one particular thing. Here we can use the transcendental meditation also. And then suhridvakya, that is guidance with proper suggestions. Sankalpa, where we use the proper sankalpa is advice, advice with the proper guidance. So that is the most important. Sankalpa and Suhridvakya is most important here. And followed by Punarshikshana, that is re-educating the person again and again to have sustained positive thoughts. And Vicharana, having some insightful, deep thoughts. Vicharya is the Pratidvanda Chikitsa, where we are, this is nothing but the nat to smart. So the replacement of the negative automated thoughts to the smart thoughts. So having specific, measurable, achievable, reliable, and time-related thoughts. So this is the Vicharya. And finally comes the Uhya and Dhyaya. So Uhya is channelizing the presumptions. So the presumptions, what we have should be channelized on a very right direction. And Dhyaya is adapting to have all these, that is winning over. Till the victory, we have to again and again do it, enduring. So we have to have all these qualities. When we have all these qualities, we will definitely come out of this with a very limited span of time itself. We will not go much far, so not into the very deep depressive disorders. We can come out very easily. And this shows that two of the koshas are related to this, that is Manomaya kosha and Vijnanamaya kosha. So the Anahata chakra and the Agnya chakra are related here. So for the Anahata chakra, we use the mudra, the Apanavayu mudra. This one is for the physical Anahata chakra, physical heart, and we use the Purna Jnana mudra for the emotional heart. And then for the Vijnanamaya kosha, for the Agnya chakra, we use this Hakini mudra. Okay, and finally we use the Kshepana mudra. This is very particularly set for decreasing the negative thoughts and increasing the positive thoughts. This is nothing but just we have to clasp our fingers like this, and then just the index finger alone has to be tilted like this. It has to be moved up so that we are going to get the positive energy from the universe. So we are going to inhale the positive energy, and then we are going to let it inside our body like this. And for giving out the negative energy, we are going to tilt it down, and we are going to give away the negative energy to the earth. So this is the way we do this Kshepana mudra. This helps a lot in this post-traumatic stress disorder. And we also use asanas like this Marjorie asana, cat cow pose. While inhaling, we can go with the positive thoughts, and while coming down, we can give out the negative thoughts. It is all about the visualizations. And we can also use this Makara asana or this Balasana. All these will help in reducing the stress. And then breathing is Nadi Shuddhi Pranayama with the Brahmari. Brahmari helps very lot in this condition. And Yoga Nidra, as usual, Yoga Nidra, where we are in contact with our subconscious mind. So we can embed a whole lot of positive thoughts there. And actually it gives a complete result in that Yoga Nidra. and then mindfulness. Again, we come back to the mindfulness where we are not in the past, not in the future, only in the present moment, so that we can handle the things very easily. So these are the ways we can handle the post-traumatic stress disorder. And I need to tell about the cases which I have handled till now. We are seeing a whole lot of cases, but specifically this works a lot in the delivery cases, pregnancy and delivery, because in the first primary, they will not be having a much of an idea. They would have seen their other friends or other neighbors or the sufferings of them, and they would have got some idea of that, and that would have caused trauma in their mind. It is not actually this trauma what we are alone facing personally. What others face also, that could also have an impact on us. So we see this in the primary cases of pregnant women, where they are already having a whole lot of things like this will happen, that will happen, how will the pain will be, like that. So when we give the visualizations and positive affirmations to them with some breathing techniques, many techniques are like the J breathing, duck walking, many things are there, and relaxation mainly. The relaxation, according to each individual, it differs. Mainly we use this rainbow relaxation, and positive affirmations where we tell them to visualize how the baby comes out. All these things, when we give importance, it happens actually. We get the results. So in one of the particular case, this is actually not a primary. This one is she was going with PCOD. Initially, she was having a kid. Second, she was trying for conception, but she couldn't, she was suffering from PCOD. So she actually came for the treatment of PCOD, and she was under the treatment. Within 2 months, she got conceived, and after that, she actually got into so much of nightmares, because she had suffered a lot with the previous delivery, where she had preeclampsia. Her BP had risen, and she had this pedal edema, and so much she had suffered, and that made her not to continue with the second pregnancy. And actually, I counseled her a lot, and she had gone through the sessions. And the thing is that she will come to the sessions regularly. Even if I say, please take some rest, she will never listen to that. She will daily catch auto and come to my place and take the sessions and go. So to that much of an devotion she had towards this kind of integrative approach. And to the positive side, the pedal edema was not there in the second pregnancy, and her BP was maintained, no history of hypertension in the second pregnancy, and she had a very smooth delivery. And she was very grateful for this. And now the child is almost 4+ years. So this was one of the case. Another case, the fetus was in the fetal anomaly scan, the fetus was having some abnormality in the kidney, and she was very much depressed when she approached me. And then we had this whole lot of sessions. After that, she last week, she had given birth to a male baby, a normal delivery. And one more case, she was from North Korea. That was an online session actually. And now I'm handling one case where she is in the 7th month. So this kind of approach really helps a lot to come out of the nightmares what we have. So the main aim of this Sattva Vajaya Chikitsa is to increase the Avara Sattva to the Pravara Sattva and maintain the Raja and Tama in the balanced state. So this is our aim, and the Ayurveda really helps a lot in this treatment of post-traumatic stress disorders, along with the mudras, pranayama, asanas, yoga nidra and all these things. And chanting really helps a lot. So this is how I like to conclude. So let's accept ourselves, appreciate the surroundings, be self-contented with whatever we are, wherever we are, because that will be the ultimate wealth anyone can possess. And be grateful for all these happenings and holistically surrender to this universal energy, because that is the magnificent energy which connects us all. So thank you so much. Namaste, sir.
थैंक यू वेरी मच हेमा जी, बहुत अच्छा बोले आप, बड़े सरल शब्दों में आपने एक्सप्लेन किया, एक्सीलेंट। अग्निहोत्री सर।
Thank you, sir.
Thank you, Professor Pawan Sharma ji. Thank you, Dr. Hema Malini ji. Really, you touched all the sensitive part of the subject matter, and especially when it's a matter of trauma and what runs in the mind of the person who sustained the injury. So, post-traumatic stress itself a very unpleasant status when a person faces it. So, what are the precautionary sites where one has to be careful? Apart from the clinical approach or the clinical management, he or she should also be given some sort of familial, emotional, social support to get himself or herself away from the stress, which is most common, most obvious to be there. So you touched all the things, and for that you talked about the Sattva. That's very good. It means at the doors of Ayurveda is everywhere open to manage the situation. So thank you so much, and it is my pleasure that you joined today from Germany, and of course with a great gap. So thank you so much. Mr. Manu Dev is also joined. Manu Dev Verma is joined, so I welcome in our webinar. He is also joining a very long gap. Thank you so much. And I would like to hand over the speaker to Professor Pawan Sharma ji for the invitation of the guest, other guest speaker. Thank you so much. Over to Pawan Sharma ji.
थैंक यू वेरी मच सर, थैंक यू वेरी मच। मैं अब आदरणीय डॉक्टर आशीष फड़के जी को सादर आमंत्रित करता हूँ। डॉक्टर आशीष फड़के जी सर।
Thank you, sir. It was really indeed very feast to listen Dr. Hema Malini, and she really presented very well the entire area now about PTSD, okay, post-traumatic stress disorder. Now, when this PTSD comes to our mind, usually this particular thing was more discussed, at least in India, after tsunami. You know, after tsunami, when you see your homes are getting devastated, your near ones are lost in that particular tsunami, and then there were a lot of people, those who were suffering from this particular condition. What is PTSD? And another wave, another time when we again heard of this is when we all suffered through our COVID-19, and particularly second wave, because when we lost so many people near and dear, even doctors or many people in that particular phase. And it was very difficult to then forget certain incidences in those period, and people, they used to get a lot of complaints, and what she has very aptly and very nicely explained. So I'm not getting into all definition and what other details about PTSD, but that is what this particular problem has evolved and came into forefront right now. It is also usually seen at the war fronts, particularly soldiers. We think that soldiers are braveheart. Yes, they are braveheart, but still they are human being, and some or the other situation which they have faced in the war front, once they come back, they can't forget those kind of memories. And it has been reported that almost 20% of veterans from Iraq war, Americans, I'm saying, and 10% from Gulf War, and 30% of Vietnam War veterans, they have suffered from PTSD. That is what is the data which is coming on American data sheet. So that is the level of people, those who are suffering from this. Another example could be like if somebody is facing through, unfortunately, any girl who has been abused sexually in early childhood or being raped in recent past. So those people, they also suffer from what is termed as post-traumatic stress disorder. So these are the some of the common, very grave condition in which this particular term is been associated with. Okay. Now, as she very typically mentioned that those who have got specific trait to which we call sattva, avara sattva, madhya sattva, pravar sattva. So there are certain traits in whom they perceive it very specifically, and then they get into this trap of this entire thing. Now, how to address this? So one way which she has also given a point towards, that is yoga. And in yoga, there is one sutra which is termed as Vitarka Badhane Pratipaksha Bhavanam. So all negative thoughts or all weird thoughts or all those memories of bad memories which are coming again and again and again, and the more you try to avoid them, the more it will be getting surfaced. So what is to be done? So they have said Vitarka Badhane Pratipaksha Bhavanam. So you create opposite thoughts to those, and place next to that. So that is what is the technique, PPB technique or Pratipaksha Bhavanam technique in yoga, in particularly Yoga Sutra, Patanjali Yoga Sutra, they have mentioned. Now, what is the current application? What is the current usage of that particular concept in today's world of psychology? So if you see, there's something known as positive psychology. So again, positive psychology is based on the similar thing. There is another group of therapies which are also quite famous, and many people they use not for treatment of diseases, but otherwise also in business also they use this particular system, and that is known as NLP, neuro linguistic programming. So in NLP, they are suggesting, and even in hypnotherapy also we use that, but in NLP particularly they use a term anchoring. So when a person comes in this particular trauma, then if you say that particular person, you now forget those things. It is gone. It was in past. So don't worry. That is what usually we say. But then that alone doesn't help. She spoke about NAT and SMART, conversion. But here they are saying that you first give him anchoring of some good memories. So usually we suggest that, okay, now you think about the best part of your life, what you have done, how you have enjoyed. Do you remember any trip or any picnic which you have spent time with your family or with your friends and you were very happy? Or have you, achieved a great goal and you won some prize or some medal or some good position in your academics or whatever, like in office? And then the moment you take that particular patient in that direction, then that person gets slowly into that thought form, and that is known as anchoring on the positive. Now, when the person gets anchored properly on that positive thought form, then you slowly enter into the current situation and the current problem which he is having, and then slowly you try to analyze with the platform of what she has also spoken, that is CBT, cognitive behavioral therapy, or sometimes even with REBT, that is rational emotive behavioral therapy. And with that, you explain that, look, you are thinking this, which happened earlier, which happened with other, but you are now here, you are in a safe mode. There are so many people to help you. There is a social support, there is a family support, and you have got these kind of potentials, and you can really understand that what you are thinking, though it was true in that particular time zone, but in T0 it was that, but now you're in T5 and this is completely different. And that way, if you make that person understand, then slowly and steadily it can be possible to reduce his thoughts in from that particular frame. Then there are certain other therapies already. As I mentioned, it is a cognitive behavioral therapy or REBT. Then there is something known as systemic desensitization. And there is one stop technique, which many times even I use in my practice. And that systemic desensitization is what, like somebody is getting afraid of going through a particular lane because there was something wrong event which has happened in front of that person's eye, okay, or with that person himself or herself. So after that, that person is not ready to even get out of house, not get to that particular direction or that lane, but slowly and steadily you go along with that person, with give him support, and slowly you make desensitization while going towards that route, and then slowly and steadily you can remove that fear, that trauma from his mind. Then stop technique is you again ask that person to be in that present moment, what she spoke in the last, that here and now, mindfulness. So it is something like that. You teach them some techniques of mindfulness, and then you can uh, help that person to go ahead with the very easiest technique for relaxation. Stress management can be achieved by relaxation. This is the common thing. And relaxation can be achieved by as simple as whether psychotherapy or not, or whether hypnotherapy or Reiki or pranic healing or whatever other yoga therapy. But simply you ask them to just breathe, slowly. The moment you breathe slowly, the thoughts are also generated slowly. And when you are generating thoughts, which are weird thoughts, which are getting generated when you are anxious, they become slow, because chale vatam, chale chittam, nischale nischalo bhave. That is Hatha Yoga Sutra. Okay. And with that, if we just do this, and in that, already I have mentioned in my one of my earlier speech, I think when it was on International Yoga Day, that you tell that person to breathe in 4 counts and exhale in 8 counts. So simple. Anyone can do. And when you do this, then you innervate that person's parasympathetic nervous system. And the moment you innervate parasympathetic nervous system, then automatically that overcrowding of thought, then fast heartbeats, then increased BP, everything will come down to normalcy. So this is one of the simplest technique I ever seen. Okay. Then there are other things like what she spoke about, pranayam. So in pranayam, you can ask them to do Brahmari, and in Brahmari, they get absorb in that sound when you put index finger inside your ear, both side, and then do humming, and that humming they get engrossed, and that moves away the negative thoughts which they have in their mind for that particular moment. Then there is Anulom Vilom. So in Anulom Vilom, again, you try to balance Chandranadi and Suryanadi. So Suryanadi is actually activating sympathetic, Chandranadi is activating parasympathetic, and contralaterally, it activates your hemisphere, right and left hemisphere. Okay. So when you do this, then they are in a position to accept what she spoke, that you should make them accept what the problem is, and then understand where you are now. What was happened, but now you are in a different time zone, different geographic location. So to make them accept and realize, and then to work on it, these things will be really of great use. Now coming down to Sattva has already been mentioned, so I'll not speak a lot on Sattva again. But one need to be very careful, because when you are dealing with cases like PTSD particularly, and if you ask them to close eye and do dhyan, then they may get aggravated. So we need to be very, very careful while handling such kind of cases. But here, when you utilize some other technique like medical imagery. So in medical imagery, you again anchor them with something completely different, something very happy mood, and then slowly you come onto the discussion part and go ahead with. So I think these are the specific techniques which we can use. With reference to Reiki, that is, and chakra therapy, we work particularly on third eye, that is your Ajna Chakra, then your heart, then solar plexus, which is very important, that is Manipur, and your root, that is Muladhara. So these are some of the things from pranic or Reiki or chakra system. And in Panchakarma, we also may utilize things like Shirodhara. Okay, we also utilize something like Nasya. Again, I don't get into the details of it, but it really works wonder. So with that, I end up here because I know it's almost 11:26. So we should stop here. Otherwise, there'll be some bad memories next day. So let us end up here. I again thank Dr. Hema Malini ji for giving really good session. I thank Dr. Pawan sir and Agnihotri sir for conducting this very important, topic for today's last session of the day. And Shubharatri.
So really, thank you so much, and you had given a lot of inputs, and
Thank
I'm
you. Thank
learning
you.
a lot from you also. So
We
thank you so
can
much.
be in touch with. I was in Aachen.
Yes, sir.
I was in Munich for some period. So definitely, I like
Mm,
to get connected with you, and definitely we can
sure,
do
sir.
something.
It's my pleasure too, sir. Thank you
Yeah.
so much.
Thank you.
बहुत बहुत आभार आशीष जी, आपका बहुत बहुत आभार। आप बोलते हैं तो बस फिर सुनने के अलावा केवल सीखना रह जाता है और
Right, sir.
इंस्पिरेशन रह जाता है। बहुत अच्छा, बहुत अच्छा। अग्निहोत्री सर।
Thank you, Professor Pawan Sharma ji. And again, thank you, Dr. Ashish Phadke sir. The moment you started your address on this issue, PTSD, really, and you talked about the tsunami, the word right from tsunami, and again you talked about the Corona period.
Okay.
It flashed into my remote memory, and
Correct.
I recapitulated again that drama of Bhopal gas test. And not only that, again I had a wonderful flash, that is our Kedarnath test. And keeping these tests away and the sufferers in a form of trauma or post-trauma stress, who can forget the deepest trauma of India
Yes.
partition? The India
Yeah.
partition, when you talked about tsunami, it flashed in my mind. The India partition trauma, post-trauma, still remains.
Right.
Bhopal MIG gas test the trauma still remains. Generations passed, so we are here to manage such type of surface trauma or the deepest trauma, the acute trauma or the chronic trauma. These traumas are standing, they are existing, and we are talking simply about the stress and the disorders. The trauma which touch the deepest status of our mind, persons have gone, generations have gone. We have seen dead bodies floating in Ganges by my naked eyes after the Kedarnath test. So being human, we are having humanity, and we do hope that all the parameters and the pathies are there, but the topmost is the sympathy. When the sympathy will be there, such type of trauma and sustained stress could be to some extent be warded off. So thank you very much for your such a nice presentation. Thank you so much to both our guest speakers, and over to Pawan Sharma ji.
Thank you,
Yes,
sir. Thank you. Now session is open and concluded.
Okay. So as the instructions have received by me from Professor Pawan Sharma ji, all the three webinars are now completed by the guest speakers presentation because of the late night hours. So we seek a few persons Ashirwad, because in our that list, Dr. Ashish Phadke ji used to be, but he himself is a guest speaker today. So was the case with the Nitin Malia ji. So what I feel that going through the present participants list, I had been having Professor Dwivedi ji, but he is not. So Madam Parul Joshi is overall in charge of today's all the three webinars for extending her guest her I mean best well wishes and आशीर्वाद. So madam, स्वागत है आपका. नमस्कार. मैम है ना? हाँ सर, मैं पारुल जोशी, नमस्कार. आइए आपने आशीर्वचन दे के आज की वेबिनार का समापन करिए और सबको शुभ रात्रि है. सभी गेस्ट स्पीकर्स का बहुत बहुत आभार है. मैम जोशी. Yes, she's there. I think yes. I have got Mr. Manudev Verma joining for first or second time. He is having a good relation or connection, rather relation with Shri Ravi Shankar ji. He is also knowing the art of living. So he may throw some light, and he is a BTech engineer. So he may throw some light, and he is my bhatija of a very good friend of mine's son. Mr. Manudev Verma, you are here and you are welcome. स्वागत है आपका. नमस्कार.
Thank you so much, sir, for welcoming. Thank you, everyone. For these things, I think we can manage these traumatic stress with our art of living, Sudarshan Kriya also.
Camera थोड़ा center करिए आपसे. Camera थोड़ा center. Yes.
So I want to just introduce this thing here, that we can manage stress, our stress at with Sudarshan Kriya. You know, we have find lot of things and lot of people who have come out of this so much stress. Just some of them, like they want to just do suicide after 2-3 days. So they have also come out from this Sudarshan Kriya, using Sudarshan Kriya, this technique in art of living. So this can also be a very helpful stress management, you know, and this will bring, and this can also be done like it is like just a breathing technique. So it is also very helpful. If you like to introduce.
So on any other day when we will be having for the mental disorders and yogic practices, I would like to invite you on that day for the expansion of this whole process of Sudarshan Kriya, so that number of persons will be benefited and time will also be conducive to them. It's already very late. So today we would like to close over here itself. Thank you so much for joining and for your kind words. Thank you.
Thank you, sir. Thank you so much.
Yes, sir. Over to Pawan Sharma ji. Namaskar. Yes, sir.
Thank you, sir. Thank you. Good night to all.
Good night.
Thank you. Thank you very much.